My surgery is next week. I can officially say it's next week. Next Tuesday, I will go to Dr. Tork's office and he will mark me up. And Wednesday morning, I will have my plastic surgery. And I am really excited. I'm really nervous. It's taken a long time to get here. I am training for this like a marathon. My husband has been supportive. I've got great girlfriends. I've got a good support system. I'm nervous about being the patient. I've always been the caregiver. I'm also nervous about just being still. Okay, here it is. It's my turn. I feel a big range of emotions, but mostly it is absolutely excitement and gratitude. My husband's here. I've got a great support team, and I'm really looking forward to this next chapter. If you're a praying person, I will absolutely take your prayers. I'm getting closer. They're getting ready to do my IVs, and they're asking all the questions, and I'm starting to get so many incredible messages from you guys. Please pray. I know it's going to be great, and I've waited a really long time for this. I'm in good hands. I know God's got my back, and let's do this.
And to think that this is the last video she got to make is incredibly sad. As you can see, this is her GoFundMe to help support her family after her husband spoke out to confirm that she died in hospice after sustaining brain damage following alleged complications.
Hello all. I know y'all know that Rachel went into surgery Wednesday morning. We got there at 6 o'clock. They rolled her back for surgery at 7:30. I sat out in the parking lot all day waiting on her to finish, and I got a phone call about 5:45 that I could come in to the recovery room. On my way in, I stopped and spoke with the doctor for a few minutes. He assured me the surgery went great, so he was heading home. Well, as he left, I could hear Rachel talking in the background, asking for me. So I went to the room. Well, on my way to the room, I noticed there was nobody else in the facility. It was locked down. It was closed. There was a cleaning crew of, I think, 2 people sweeping the hallway. And when I stepped in the room, there was one nurse in there with Rachel. And then there was another nurse that had stepped in, but she was going back and forth throughout in and out of the door. So anyway, Rachel could hear me talk, so she heard my voice. I stepped around to the side of the bed and touched her arm, and she knew it was me touching her. Well, next thing you know, the one girl that was outside the room walked in and asked her, said, "How's your pain?" Rachel kind of mumbled. Well, the girl said, "Oh, I was just checking because a few minutes ago I gave you your pain med, which was 0.5 Dilaudid and 150 fentanyl." Well, me and the other nurse is talking because Rachel had told them when she met me at what age, so we're bullshitting. Well, as we're doing that, next thing you know, I look down and her face is off color, white. I assumed it was from the surgery, lack of blood. But anyway, I said, "Rachel," and she didn't answer. Well, the one nurse in the room said, "Rachel," no answer. I got down in her ear and hollered Rachel a couple times, no answer. Next thing you know, the nurse starts with the knuckles to the sternum. But it was kind of weird to me because it didn't seem like much sense of urgency with her lips being blue. Then she reached and grabbed the bag. Well, she put the bag on her and pumped it once or twice. The bag wasn't sealed around her face. And then she walked away and grabbed some Narcan, came back, hit her with Narcan, put the mask back on her face again, and this time opened her mouth and pumped 2 or 3 times and then walked away again. Dr. Torque was on his way back, there was no response from the Narcan. When Torque came in, or when the plastic surgeon came in, he assessed the situation and made sure told him to call 911. And the nurse hit Rachel with another dose of Narcan with it not doing anything. So, ambulance rushed, picked us up at the surgery center, brought us to Bethesda North, and and this is what we're looking at. She was without oxygen for over 6 minutes, supposedly. I don't know how that happens when you've got a crew that was supposed to be taking care of her. Was told last night that she's brain dead. I've got a couple days to make a decision. To me, it looks like incompetence.
And sadly, in this case, it ended with her losing her life and not just regrets.
I'm here to ask my TikTok community for advice or guidance or something. I'm really embarrassed. I have a really hard time going to the doctor, but I've made an appointment for Wednesday because I think something has gone wrong with my tummy tuck, maybe. So everything seemed to be fine with my recovery. But in the last couple months, I have just had excessive swelling and pain. Like, it is just off the charts difficult to deal with sometimes. And a couple of weeks ago, I was laying down for a nap because I've also been incredibly tired. And there was this really sharp pain and pop in my stomach that woke me up out of a nap. And I had just had an anxiety attack because I had to shoot a wedding that day. I'm a photographer and I had to go directly to shoot a wedding, and so I just pushed through it. But ever since then, my stomach area has been very, very swollen. And I have an appointment on Wednesday, so I am going to see someone. And, you know, I have intermittent times where it's more or less swollen, but, like, can a suture pop a year post-op? Because I don't know what else this could be. I thought maybe it's like a lady issue or something, but it's all, like, my entire wall of muscle in the front is just swollen and uncomfortable. I really was hoping that the tummy tuck would help with my debilitating hip and back pain. That the muscles being tightened would help with things, but I'm in pain so much. And I am so embarrassed to admit this because I just want to tell you guys everything is fine, but it's not.
It's day 7. And I am an emotional, crazy person. Does anybody else feel this way? Like, it's only been 7 days and I'm already over it. Like, if I could go back, I would go back. And I have done this. Like, the pain, I'm over it. The not being able to get up on my own, I'm over it. Not being able to sleep, I'm over it. I don't even know why they call it a tummy tuck. They should call it a back tuck. Like, my back is what it hurts all the time. I'm just so emotional today. And it's only been 7 days and I'm like, how am I gonna go months of this? Does anybody else feel like this, or is it just me being a baby and throwing a tantrum?
Quick PSA to anyone considering getting plastic surgery. Don't do it. I had an extended tummy tuck with muscle repair and breast lift and liposuction a week ago. That was the biggest mistake. I coughed tonight. I'm pretty sure I saw all my ancestors. This has been the hardest recovery. I've had 6 children, 1 C-section. I've had a knee replacement. I've had kidney stents. This is like the biggest regret ever. If you're considering it, don't do it.
What hurt me the most is that I have 3 children to take care of. I have 3 children to take care of. And right now, I cannot even take care of myself. And they don't care. They don't care. All they care about is their image. They don't want me to tell my story. They don't want me to talk about what's going on with me. They just want me to be mute. And I refuse. I refuse to be mute. I want everybody to know what happened to me so that this can stop. So you can't give a free giveaway, a free surgery giveaway. Talk about women empowerment. Talk about helping women with their confidence, and you going around botching people and neglecting people, and I'm not the only one. So many girls reach out to me. So many girls reach out to me with the same thing. It hurts so bad.
Every day after work, Lisa spoke to her via phone, often for hours at a time. She was on a regular basis.
It hurts so bad.
Do I regret it? Yes, I do. I wish I wouldn't have gone. Tomorrow I am going to be having my hysterectomy, tummy tuck, as well as diastasis recti to be sewed all back together, a breast lift, and something with my areolas to make them a little smaller.
So it's 5 in the morning and we are headed to the hospital now.
But her situation deteriorated even further once she got home to recover. It was anything but easy.
So I have an incision that looks like right up my stomach. This is a really long line right here. Let's see what it looks like down here. Whew. So that is definitely a gnarly line. Oh my Lord. It will be 1 week since I got my tummy tuck and my breast lift. I thought I'd show y'all what things are looking like now. There's a scar. You can tell that I'm swollen, or this would be pushed in a little bit. I think these are tubes from my drain lines right here. At least I hope that's what they are.
The swelling eventually faded, exposing the terrifying truth behind her results.
2 weeks post-surgery. I'm happy with some areas. I'm not happy with other areas. I share everything else, so maybe I should share my disappointments. This is what this looks like. I think I'm happy with up here, but I'm going to show you what this looks like. You can kind of see the wrinkles that are all forming as the swelling has gone down. I didn't need help getting a flat stomach.
Can all her intense training finally get rid of that excess skin?
The only thing that I can't do with hard work is remove wrinkly, excess, stretched out skin. And that's the only thing I want it done. Like stretch marks, I can't do anything about those. Wasn't expecting those to ever disappear. Let the stretch marks be as they are. If you can't salvage my belly button, I don't really care. That is where we are.
Things went downhill. Her health started deteriorating.
I've been battling an infection that has spread to my bladder and my bowels, and basically just spread everywhere, which has made my bladder not work. Now I have a catheter. I just cannot mother with all of this happening. Like, where is this even supposed to hook onto? Am I just supposed to sit down on the couch and just do nothing with my life?
After a long recovery, the infection finally resolved. But despite having her health, she is still not satisfied with her appearance.
Will I get a tummy tuck revision? So here's some before pictures. Here are some after pictures, and as you can tell, there is still a lot of wrinkly skin left. I'm not gonna go through with revision. I think it was against my better judgment to even get a tummy tuck in the first place. 1, because it's a strain on my family. 2, mentally I can't handle it. 3, my body can't handle a 10th surgery. 4, I've been in chronic pain since I had the tummy tuck. And the 5th reason would be I don't trust doctors. I don't trust them to know my body and listen to me about my own body more than they listen to some stupid textbook.
This is the 24th day after my tummy tuck. My baby has moved on. I'm full of regret. I'm regretting my life by fast. And I know it's the last comment of a fool. I'm a fool. And I had a hole bigger than a 50p piece. And I was feeling sicker and sicker, but the hole, this sounds gross, it was oozing. And I was really starting to panic. I had no aftercare, no nothing. Adam wasn't answering his WhatsApp messages. I was getting nothing. So I called an ambulance. But what I did have was MRSA. And it was eating my flesh around the wound. And this is so scary, like, and I'm being honest on here because you guys need to know the ins and outs of picking the right and wrong surgeon. And this is another reason why I'm doing it, is that surgeon, Adam, I would never recommend. I don't want anyone falling into the position that I did, okay? I remember them packing, so I had like a tea towel around my side because it was the nearest thing I had. I had a tea towel and I had a tea towel on my hip and I was holding it tight. Anyway, the tea towel was drenched with fluid and they packed it with lots of the white packing stuff. I don't know what it's called, packing fabric, I don't know. And I was watching them carefully and I remember the nurse saying, you probably will not be allowed to go to your GP practice to have this done every day. You're going to have to learn how to do it. So for 3 months after that, I had to pack out the wound, make sure everything was sterilized, and I had to do this every single day, right? So it's a lot. And I thought I was getting somewhere, and then another hole appeared beside it. So I got another course of antibiotics. I had to pack 2 holes. Then I went in to get a checkup done when things calmed down a little bit. And they said, we're going to have to use silver nitrate on the joint between the two to make it one big one. I was like, this is never going to heal. Like, I'm going to end up with a big holy hip. And thank God and touch wood, it did heal, but it took about 6 months in total. And I was quite ill during that whole period. And I remember contacting the clinic when it reopened saying, you did not do my liposuction. And money was tight then. Not that I'm rich now, but like money was a lot tighter then. And I couldn't find anywhere that would operate on me. It's really hard to find someone that would do a revision if it's not their work. And they said, right, okay, we're offering you, it's normally 3,000. We're offering you to have the lipo done for 200 if you can come over here. And do you know what? I went. I went and had lipo done by the same creature who caused the issues. Like, what a mug. What a mug. And I remember having these marks all up my side from the long tube to do the liposuction. There's no need to do all this. Like, I've had lipo since. There's no need for that. So I had all these bruises up here and these long marks on my skin. And again, my flanks, love handles, were not gone. What a mug! Bring it in, Shy. Yeah, so I had to live with it. So when I did heal, so the belly button's here in the center, okay? So the scar went up like this, causing 2 rounded pockets of skin with fat in it because the lipo wasn't done. Around like that. So I had like an upside down McDonald's symbol going on. Absolutely horrendous. And another thing they do not tell you about a tummy tuck with a guy or a tummy tuck with somebody like myself that's biologically male is your downstairs male bits are pulled up. Okay? So they're pulled up and your tummy's pulled down to do the tuck when the skin's removed. So I remember going to the toilet and weeing everywhere because it was in a different position to what I was used to. They don't tell you this. There you go, a little interesting fact for you. So anyway, I complained and complained. Europe surgery was so rude towards me. It was unbelievable. So that was a no-go. Adam didn't want to know. He didn't want to know. Now I found out lots about Adam. He's been sued since and everything. So he's back practicing. Do not go.
just do not go. Yeah, and that was my tummy tuck journey. And I remember the scar as well. The scar was as thick as my thumb, as thick as my scar. It was worse here because of the opening from the MRSA, but it was as thick as my thumb, and it was just pure ugly. Like, before, at least I was big and you could see there was a reason for the look that I had. This was like Frankenstein. Like, it was the shape of it, the thickness of the scar.
How was I get a video of it? Okay. So, did you contact the doctor? Have you sent this video to the person that did the surgery for her? Did the tummy talk for you?
Yes.
What did she say?
They told me that I should come back for the debridement also. Then the wound was having the skin, but it's dead. So they said I should come back for the debridement. So that was why I came back the second time. So when I came back, they told me that I can't stay in their facility, that I should go and stay in hotel. That I'll be coming from hotel to the facility and come and be doing dressing. And I was really in pain. Even the day they told me to come, they said their car is going to pick me up in the airport. When I arrived, nobody was there. They didn't even give me address.
Where did you come from to do this?
From Abidjan.
From Abidjan in Ivory Coast?
Yes.
You came all the way from Abidjan to do this? Are you Nigerian?
Yeah.
Your both parents are Nigerian?
No, my dad is Nigerian.
Your dad is Nigerian, your mom is Ivorian?
Yes.
Okay. So, and then when you came from Ivory Coast, wait, you did it, then you went back to Ivory Coast?
I went back to Lagos because I have people there that can look at me. Okay. That was why I went there. Okay. Because there's a lot of aftercare facilities in Lagos.
Okay.
And I know, I've never been to Abuja. I think the first time. So I cannot stay alone. I need help. That was why I went back before we started. Even before I fly, the signs had already started coming out. The day they did the surgery, my body was there was a lot of blisters in this wound with water inside. So I told them, I said, why is my body like? They say it's going to go. That my body is sensitive. That was like, even the same day, the lady was like, remove 4 liters of fat in my stomach.
What's the lady's name, please?
It's Dr. Sandra.
Dr. Sandra.
Yes.
Yeah. Okay. Wow.
So then,
were you conscious when they were doing this, or
they put me to sleep?
They put you to sleep, so you were not conscious. So you just woke up and you saw the blisters,
yes.
And then you asked.
Yeah. Before I left the hospital, the nurses they use that injection. That means they use it and burst all the blisters.
How many blisters?
It was much like this one part. That was where the blisters.
Oh, so the blisters were yes. So they were the one that busted it.
Yes, that was the first stage of it. Before the cleaner.
So when did this whole thing happen? What day? Do you remember the day? The date?
I became open finally.
No, the date you went there for this.
On the 8th of November.
On the 8th of November?
This month, yes.
No, this month is December.
Yeah.
8th of November, so it's not up to a month. Yes. In 5 days it will be a month.
Yes.
And then you started saying all of this after how many days?
That same week, my body formed that, what's the name? That black necrosis, as they used to say. So then I sent them the picture. Then I said I need to come back for the debridement. So going back, and then even before I went, we went to hospital because I was not breathing well.
I had a tummy tuck 18 days ago, and I'm going to give a little trigger warning here because I'm going to be talking about wounds and stitches and everything related to that. It's kind of gory, so if you don't want to listen to that, then turn off now. The day before yesterday, I went to put some cream on my incision, which was healing incredibly well, and realised that I actually had some fluid coming out of the incision just in a little part. I contacted my surgeon. He told me to try and milk it out. It looked kind of infected. I'm on antibiotics anyway, so we weren't overly worried, and he just said just try and get it all out. And the reservoirs that it came from was all over. I was able to push it out from all over. I did all of that. And then yesterday I realised that this tiny little hole that it was coming out of had actually grown. So it's nearly 2 centimetres wide, which is making me feel sick thinking about it.
Everyone shows you the after, the flat stomach, the confidence, the glow up. But what about the scars you don't see, the complications, the regrets? Today, we're talking about tummy tucks, the truth doctors don't always emphasize, and why more women are starting to question if it's really worth it. A tummy tuck, also called abdominoplasty, is a major surgery where excess skin and fat are removed and abdominal muscles are tightened. Sounds simple, but it's not a quick fix. It's serious surgery. This is not a spa treatment. It's major surgery involving anesthesia, cutting, stitching, and long recovery. The risks include infection, blood clots, fluid buildup, poor healing, and permanent scarring. One study of nearly 25,000 patients found that about 4% had major complications, which is significantly higher than many other cosmetic procedures. Combine it with other procedures like liposuction, and the risk jumps even higher. The most dangerous complication, blood clots traveling to the lungs, called pulmonary embolism, happens in a small percentage but counts for a large share of deaths after surgery. Let's be clear. Death is rare, but it's not zero. Estimated mortality is about 1 in 10,000 procedures, and in 2026, Rachel Tusi tragically died after complications from a tummy tuck. And this isn't meant to scare you. It's to remind you this is real surgery with real risks. The recovery is long and painful. Weeks of limited movement, can't stand fully upright at first. Pain, swelling, tightness, months before final results. And if something goes wrong, recovery becomes even longer. And something many people don't tell you, you might not even like the results. You might have uneven results, visible scars, skin discolorization, and need for revision surgery. Some women go through all that and still aren't happy. And of course, not everyone regrets it, but regret exists, and it's more common than influencers admit. Here's the part that no one talks about enough. A tummy tuck doesn't fix body image struggles, low self-esteem, or comparison culture. If you don't love your body before, surgery doesn't magically create that love after. More women today are asking a different question. What if I don't need to change my body at all? Instead of surgery, fitness and health goals. Because confidence isn't stitched into your skin, it's built into your mind. At the end of the day, it's your body, your choice. But make sure it's an informed choice, not one influenced by pressure, trends, and unrealistic beauty standards. Because the truth is, you don't need surgery to be worthy. You don't need a flat stomach to be beautiful. And sometimes, the real glow up is learning to love yourself as you are. Many people do have successful outcomes, but understanding the risks is just as important as seeing the results.
I have a PSA. Anybody who's thinking about an elective surgery, breast aug, tummy tuck, lipo, all of it, do it in a hospital. The response time is critical when you happen to have an emergency situation. We can all speculate what happened to Rachel. Some say it was a medication error. Some say maybe she threw an embolism. We don't know until there's an autopsy, and apparently the family has retained a lawyer and is suing for malpractice. So maybe some of it will come out and we'll learn, but if you're going to have one of these surgeries, I would say that you should ask, if you're doing it in a surgery center, what are the experiences of the nurses? Are they ICU? Is there a crash cart? Are they a 911 facility? What will be the response time if you unfortunately have a code and have some type of reaction? If it was me and I was guiding anyone, I would pay the extra money to have it done in a hospital. And these surgery centers all popped up for profit. If you look back into the history, a lot of times they're owned by anesthesiologists, they're owned by plastic surgeons. It's a way to cut out the hospital and make more money. It doesn't necessarily mean it's there for your benefit as a patient. It doesn't mean that you're going to have a better outcome. And people will disagree and they'll say they're perfectly fine and safe. I expect that, and you really should ask the questions before entering an elective surgery. What is the emergency protocol if there is one?
Thanks for watching. Don't forget to subscribe for more real, honest conversations like this. Now I want to hear from you. Would you ever consider a tummy tuck, or do you believe self-love is a better path? Tell me in the comments. But for now, see you in the next one. Bye.